He struggles through the 2 minutes interview at the Karen Hospital's male ward.
Mpaka na mgogo na kifua na kukula na kichwa. Mpaka mikono inikuwa nauma. Sasa nikiwa kwa shule nikaumwa sana. Mama yangu sasa nikakuja nikaenda nikamwambia. Sasa akanipeleka Gatundu.
Usiku akaniambia nifanye haraka, mtoto huyo anataka kusaidiwa, akuje hapa hapasiwe.
15 years old standard 8 pupil at Muhoho Primary School in Gatundu South, John Gitau Kariuki, is waiting and hoping against hope that the all-important surgery to replace his 2 valves in the heart destroyed by sickness can be done in the nick of time to save his life and restore him to good health. According to Dr. Daniel Nduiga, the physician cardiologist at Karen Hospital, Gitau is suffering from congenital heart disease, which has been worsened by rheumatism.
He had actually recently been admitted at Kenyatta with joint pains, inability to walk, lots of panting, and we transferred him here to be able to give him better specialized care. We find that one of his valves is leaking quite a bit to the point that the heart becomes large and poorly functioning. Now, that is something that children are born with. It's not that the parents did anything. It's just something that they are born with. They're called congenital heart diseases. Unfortunately for John, he gets 2 strikes. One he was born with, which has worsened along the way, and is a primary lesion. But now he came to the hospital with what is known as acute attack of rheumatic fever.
Being an emergency, the Karen Hospital, through funding from Heart to Heart Foundation, can conduct the open heart surgery and restore Gitau to good health. But this is only possible if well-wishers chip in to the tune of 1 million shillings to have the surgery conducted.
So our appeal to all well-wishers is that please assist us, get the money required for his surgery so that he can be able to go back to his normal life. And
na sasa mimi sina pesa. Mimi nataka kila wa Kenya wanisaidie.
Watu yote ya Kenya wanisaidie. Mkinisaidia nitafurahi sana. Mtoto apasiwe atibiwe, arudi nyumbani aende shule kama watoto wale wengine.
Funds to enable Gitau to undergo the operation can be channeled through M-Pesa pay bill number 517800 and on account Heart to Heart, or by check payable to Heart Foundation. As the 2 parents watch over their little son's struggle, many could be asking what became of Kenya's health sector.
The health sector in Kenya, unfortunately, is very poorly funded. We have the WHO standards of 15% of our country's GDP put back into the health sector. Unfortunately, the last statistics we have of conversion of investment in health is only 6 to 7%. This has ramifications when you look back on what's happening in terms of the care that we're able to offer. So the public sector is overloaded, overwhelmed, ill-equipped, and has very few staff. Now, private sector has come up to be able to bridge the gap. Unfortunately, private sector means that you and I invest in something and need to have our money back, or at least be able to pay for what we've already invested in. As a consequence, private sector has found itself caught between 2. The moral dilemma of being able and being willing to help, and the point of being able to pay your own staff.
As universal access to health services remain a pipe dream, perhaps a paradigm shift is needed to heal the health sector. Judith Akolo, Channel One News.